Is age any a factor in any way in tumors, sir?
No, unfortunately not. You see, the range of tumors which can happen in the brain it's a huge range.
Right.
There are different types of tumors.
Right.
Some tumors are seen more in infancy and childhood. Some tumors are seen in the middle age, between the 30s and the 50s. And there are other tumors which are seen later on in life. So you can get a tumor at any point of time in your life. The tumor may differ in its pathology, but it will be a tumor.
Okay. So you said it is related to genes. It is related to human. It probably goes back to birth. Why in that case has there been an uptick in the number of tumors in the country? So why has there been an increase in the number of brain tumor cases in the country if it was all just related to pure,
I don't think that there has been an increase in the number of tumors. I just think that with better technology, increasing better infrastructure as far as imaging of the brain is concerned, and more accessibility to good health care, that we are seeing more tumors being diagnosed.
Okay, so there's more discovery of them, or
yes, I think basically there is more discovery. I don't think there is. I mean, there are more tumors developing, but I think we are looking at them because we see what we know. And currently, we are able to see so much with modern technology that we are able to discover even small tumors. And therefore, the numbers of tumors that we are seeing are definitely much more.
Okay. Sir, I want to take you through this, okay, headache, discovery. What are some of the treatment options available in front of patients today?
There is one simple rule. I mean, let's not go into gray zones. One simple rule for brain tumors. The best chance of a cure for a brain tumor is by surgical removal of the tumor. That's the best chance, and that is what should be done in about 95% of all tumors that are seen in the brain. The remaining 5%, there are a few other options, but majority would require some sort of a surgical procedure to get the pathological diagnosis.
Okay.
So at the end of the day, that is also a type of surgery, but you're not going to remove the tumor, you only get a biopsy. So end of the day, if you see a diagnosis of a brain tumor,
right,
needs a surgical procedure. Most of the time to remove the tumor or to get a biopsy. Because without pathological diagnosis, you don't know what the tumor is. And currently, we just don't look at a slide. It's all molecular pathology. So we can know very clearly what is the type of tumor, what type of tissue it is coming from, what is the growth rate of the tumor, and there are a lot of specific treatment methodologies for specific tumors.
Okay.
And therefore, I think that would be necessary before we go ahead.
Okay. If I have to ask you about the specifics of the surgical procedure, what does the procedure look like, sir?
Okay. I mean, there is a lot of misconception about brain surgery.
True. True.
Some patients even ask me whether we unscrew the top of the head to remove. No, it is true. That's unfortunately the level of information that has gone down to public, and perhaps we are at fault for not giving that information or raising the level of awareness. But what we do now is that, again, technology has come so that the way we do surgery now is completely different from the way we used to do surgery maybe 20 years ago.
Right.
We now have very precise localization of where the tumor is. So I know exactly where the tumor is in the brain, in the head. And with a machine, something like a GPS, we use a navigation so we know exactly there. And therefore, we don't have to make a big opening in the skull.
Okay.
So one thing is, the question asked is, do we have to open the skull? Yes, we have to open the skull because the brain is encased in a very thick bone. So however we do it, we have to open the skull somewhere. But the opening is not very big. So most often it's a smaller sized opening directly related to where the tumor is. The second is we use equipment, most often called the operating microscope. Now, this is a big machine with a lot of technology built into it, where it gives us not only good light, it helps us magnify the tissues to about 10 to 15 times. It gives us filters of different types so that we can distinguish normal from abnormal. So what happens, and we use instruments which are less than 1 millimeter in dia at the tip. So it is sub-millimeter instruments. Therefore, the surgery now is extremely precise. So we go straight down to the tumor without cutting much normal brain, and we remove only the tumor. We don't pull or push or remove normal brain.
Okay.
When we do that, we now also have the technology to monitor the functioning of the brain. And we are able to map and track the nerves around the tumor in the brain itself. So we know we are not disturbing the normal brain tracts or normal brain nerves or tissues and things like that. So what has happened is surgery has become precise, surgery has become safe, and therefore we are able to do more, but with less risk to the patient.
Okay.
So patient safety, patient outcomes have become much, much better. And once we finish the surgery, we close all the layers. So we close the covering of the brain, we put the bone back, we close the scalp. And most often this is done behind the hairline of the patient, so that once the hair grows, sometimes you don't even know whether the person has had a brain surgery or not.
Or not. Okay.
So that is how actually a brain surgery takes place.
That's a complex, almost
It is
like
complex,
space
but
science.
it is all technology driven.
Right.
And because it is technology driven, it is precise and much more safe than you would think it is.
Okay. But what's the recovery period like, sir? After a brain surgery is done, what is the recovery period like?
So generally speaking, if a patient has a brain surgery today, unless it's an extremely complicated surgery, let's not go to that. But on an average, the person with having a brain surgery would be awake within a few hours of the brain surgery, of the finishing of the brain surgery. The next day morning, the patient would be sitting up, having some liquids, then breakfast maybe. We normally mobilize the patient. That means get the patient out of bed. We make them walk to the toilet, things like that. So that is the recovery, so that in a couple of days, the patients can go home. So that's the sort of recovery of the patient post a brain surgery.
Okay.
So no more is the thing that the patient with the brain surgery is in bed for a week, 10 days, things like that. So it is out of bed fast and to the ward where rehabilitation or whatever is needed is done, and the patients go home as soon as possible.